All right, so you're about to start your AR rotation, huh? Want to make sure you're totally on your game when those little ones come through the door? Well, you've come to the right place. We're tackling pediatric trauma in this deep dive, and let me tell you, we've got an expert here who knows how to make this stuff stick. We're talking bridging that gap between textbook knowledge and, the real deal when things get intense.
You bet. Pediatric trauma, it's a whole other world.
Totally. And the research we dug into for this keeps driving home this point. Kids are not like just small adults, which, yeah, okay, we hear that all the time, but what makes that difference so crucial when we're talking trauma?
Think about it this way. Treating a child for trauma, it's almost like you're dealing with like a totally different species. Seriously, their anatomy, their physiology, it's all a moving target, right? And that changes everything. Take their head-to-body ratio, for instance.
Oh, right. Their heads are way bigger proportionally compared to us grown-up folks.
Exactly. And that makes them so much more vulnerable to head injuries. Even from Pole's head, for an adult, no big deal. Plus, their skulls are still fusing, so the way that force impacts them, totally different.
So a little tumble for them could be
A really big deal.
yeah, more serious than we'd think.
And the anatomical differences don't stop there. Their bones are still growing like crazy, too. Way more pliable than adult bones.
Which is why we see things like green stick fractures more often.
Yeah,
Right?
exactly. That bending and cracking, but not like a clean break.
Right. Bend and snap, not a full-on snap.
But here's the thing. Managing those fractures, especially near growth plates, whole
Yeah.
different ballgame.
Yeah.
You've got to prevent long-term growth problems. It's not just about putting the bone back together. It's about working with a structure that's, still under construction.
Wow. It's like you're trying to fix it while it's still busy building itself.
Exactly.
What about those physiological differences? I know the research mentions stuff about metabolism and body surface area playing a role, too.
Huge factors. Kids, they've got these supercharged metabolisms, helps them heal faster, which is great. But flip side, they lose heat so much quicker than adults. All that surface area.
So keeping them warm during a trauma, that's
Absolutely crucial.
not just like, oh, let's make them comfy.
No, it's critical for their whole system staying stable. Same with fluids. Totally different needs.
It's wild how these tiny differences can make such a huge difference in how we approach their care. So we've covered the basics, like why kids aren't just tiny adults when it comes to trauma. But the research, it goes deeper, right? How these differences actually play out at different ages, and that's where things get really interesting.
It's wild, right? Like a traumatic event that might leave an adult with a few scrapes could be devastating for a child. And what kind of injuries we're dealing with changes so much as they grow.
Yeah, the research kept highlighting infants, like how incredibly vulnerable they are. What makes them like a unique category?
Well, they're still developing so rapidly, right? Their bodies are just so delicate. Especially their heads.
Makes sense.
That big head-to-body ratio, like we talked about, huge factor here. Plus, their skulls are thinner, more pliable.
More vulnerable to everything.
Exactly. Fractures, bleeding inside the skull. So even what seems like a minor bump could be a huge deal.
So if we're examining an infant after a trauma, what should we really be paying attention to?
One of the biggest things, bulging fontanelle.
Right, that soft spot.
Totally normal part of their development, but in a trauma situation.
Yeah.
Could be a sign of dangerous pressure building up in the skull.
Oh, wow. Okay, so that's one to watch for sure. The research also mentions something called the Pediatric Glasgow Coma Scale. Is that basically a different way of checking how responsive they are, like their level of consciousness?
Exactly. You can't use the adult one on an infant, right? They can't exactly tell you what hurts or follow commands. So the pediatric version,
Yeah.
it's all about assessing them based on their developmental stage.
Right, because what's normal for a 6-month-old versus a 2-year-old, totally different.
For sure. So we're looking at things like eye movements, how they respond to sounds, even how they move their limbs, all age appropriate.
So we're adapting our whole approach, basically.
Exactly. And then you've got toddlers.
Oh, boy. Toddlers. Whole different ballgame, right? They're like little explorers, but always leading with their
Heads, yeah,
Yeah.
in their mouths.
Oh, right. Putting everything in their mouth.
Airway foreign bodies, that's huge with
And
toddlers.
their airways are just so tiny.
Exactly. Even a small object can cause a big obstruction.
It's amazing the things they'll try to, like, swallow.
Tell me about it. We see it all in the ER. Small toys, coins, food. You wouldn't believe it.
What makes it even trickier is that it's not always, like, super obvious, right?
Right. You might not immediately think, oh, it's a foreign body.
Yeah.
They might just have a cough. or seem like they're having a hard time breathing.
So we got to be extra careful.
Definitely. And then there's teenagers.
Right, teenagers. Getting closer to that adult stage, but still so much development happening.
And they start to mirror adult injury patterns more.
Like we see more sports injuries, things like that.
Exactly. Car accidents, unfortunately, intentional injuries.
Oh, right, like self-harm or
Yeah.
heavy stuff. But their bodies are tougher, right?
They tend to be, yeah. More resilient than those younger kids.
Right.
But the emotional and social impact of these injuries, that can be huge at that age.
So important to remember that it's not just the physical stuff,
Yeah.
it's everything.
It's amazing how much a difference a few years makes when we're talking about kids and trauma, huh?
Mm.
Each age, it's like its own little puzzle. But speaking of puzzles,
Mm.
the research mentions some pretty specific tools and techniques they use in pediatric trauma. What like the essentials? If you're heading into an ER rotation, what do you really need to know?
Oh, there are definitely some specialized tools of the trade, you could say. And one you will become very familiar with is the Broslow tape. It's like your cheat sheet for pediatric trauma.
Cheat sheet. Okay, I'm listening. Tell me more.
So it's this tape, right? Blight colors, like a giant ruler almost. And we use it to estimate a child's weight based on their height.
So you just like hold it up next to them. Pretty much. Find their height on the tape, and boom, that section tells you everything. What size equipment to use, what dosage of meds, even how much to inflate the blood pressure cuff.
Wow, that's incredible. It takes out the guesswork.
Exactly. And in pediatric emergencies, every second counts. So the Broslow tape makes sure we're giving the right treatment right away, and it's all tailored to that specific child's size.
That's really cool. The research also mentioned the pediatric trauma score. What is that exactly?
Think of it like a triage system, but
Right.
specifically for trauma. It helps us figure out really quickly how serious a child's injuries are.
So we know who needs to be seen, like right this second.
Exactly.
Yeah.
We factor in things like their airway, are they breathing okay, what's their blood pressure like, how alert are they, even their age gets factored in. And based on all that, we give them a score. Lower the score. More critical the situation.
So it's all about prioritizing.
Exactly. Now imagine this. You've got a child who's critically injured, but you're having trouble getting an IV line in. Their veins are tiny, they're scared, maybe even in shock. That's where IO access comes in.
IO, meaning going into the bone.
Yep, directly into the bone marrow.
That sounds intense.
It can seem that way, but it's actually very safe and effective. Done correctly, of course. And when you need to get fluids and meds into a child quickly, nothing beats it.
Wow. So in those really critical situations,
It can be a lifesaver.
Yeah.
Literally. And that's what it's all about, right? These tools, these techniques, it's about giving these kids the best possible chance, especially in those first few minutes after a trauma.
absolutely. And speaking of making a difference, the research touched on a tough topic, but so important, non-accidental trauma. And this is where our job goes way beyond just like fixing broken bones, right?
You got it.
Yeah.
Non-accidental trauma, child abuse, basically. It's a reality, and we
Ah.
should be ready to recognize it and intervene.
So what are some of those like red flags, the things that would make you suspect abuse might be going on?
Sometimes it's a gut feeling, like the story just doesn't line up with the injuries, or the child is acting really withdrawn, really scared. Other times it's more concrete, like they have fractures that are healing, but at different stages, which tells you those injuries happen at different times. Or burns, but they have a really unusual pattern. Bruises in places you wouldn't expect from a typical fall.
So it's about like really observing, noticing those little
It's
inconsistencies.
trusting your gut. If something feels off, it probably is.
And then what? What do you do if you suspect abuse?
We have a responsibility to report it, right?
Yeah.
Legally, ethically, we have to. Child Protective Services, law enforcement, whoever we need to make sure that child is safe.
It's a heavy responsibility, but ultimately.
It's about protecting those who can't protect themselves.
Yeah.
Absolutely.
Okay, so we've talked about the initial response, but what about the long game? The research talked about long-term effects of pediatric trauma, too. It's not just about getting them patched up and out the door, right?
Not at all. We have to think about the physical complications, for sure. Like if there was a fracture near a growth plate, that could cause problems down the road, but also the psychological and emotional trauma.
Yeah.
That can have a huge impact on their life and their family's life.
So follow-up care is so important.
It's crucial. And it can involve so many different things. Physical therapy, maybe occupational therapy, counseling, definitely. It's about treating the whole child, not just the injury.
This has been such an incredible deep dive. You've given us so much to think about. Any last words of advice for our listeners out there as they get ready to start their ER rotations, work with these little humans?
You've chosen an amazing but tough field. It's challenging, rewarding. Remember to trust your gut, lean on your team.
Mm.
You don't have to know everything. Ask for help. And never, ever forget how much of an impact you can have. You, just one person, can make all the difference in a child's life.
I love that. And to our listeners, good luck out there. You've got this. Every experience, even the tough ones, you're learning. And we'll be here, ready for the next deep dive. Until next time.